Institute of Disaster.
Please, sir, go ahead, sir.
National Institute of Disaster Management is taking up a training program in disaster management to college teachers. I was really very much impressed with this because unless we prepare the end user, we will not be able to deliver goods. When we go with some resources, the final recipient must be wholeheartedly ready to receive that relief work, whatever we are going to do. I was going through the timetable that academic staff college has created. Whether it is tsunami, flood, earthquake, landslide, and other things, we are not facing these problems at present. And leisurely we are sitting in the warmth of our rooms and learning something about it. But this COVID topic that is allotted to me, we are on a burning fire. We have seen the past and we are very much cautious about the future. So I thought, instead of simply bombarding you with the scientific material, let me just title this as Societal Response to COVID-19 till now and what we expect in future, if at all there is a third wave. So we have a task ahead for each one of us. Look at my first slide. Maybe this slide I've used in not less than 200 of my lectures, more than 100 in academic staff college itself. This is not a new slide. This was not coined after COVID. This was not even coined for H1N1. Nobel laureate, Dr. Joshua Lederberg, is a physiologist. He said the single biggest threat to man's continued dominance on the planet is the virus. Maybe he has told about this threat in 1950s itself. Maybe we never realized it. When H1N1 pandemic came in 2009, maybe I realized it, but I failed to make you people understand to whomever I came across. That is it. Let me start with these 3 slides. How important it is if you want to survive and deliver goods to the society. Same Dr. Joshua Lederberg said, we live in an evolutionary competition with microbes, that is bacteria and viruses. There is no guarantee that we will be the survivors. What is the meaning of this sentence? Instead of man killing the viruses and bacteria and surviving, it may be the other way around. Look at the third one. The microbes, whether it is bacteria or viruses, they are challenging us in ways we would not have imagined 10 years ago and for which we were not prepared. Look at simple bacterial infections itself, whether it's a pneumonia or some internal organ infection. We were ending up with simple antibiotics costing not more than 1,000 rupees for the entire course. Now, trust me, every month, one of my patients ends up spending 2 to 3 lakh rupees on newer antibiotics itself because of the development of drug resistance. So with this background, let us see what are today's objectives. One is to assess the possible scenarios in the event of a possible third wave. Third wave, it is not a man-made some propaganda, I will just prove why it is not just a propaganda with some evidence. And propose solutions for addressing the gaps therein. Because second wave, we were not prepared for the big number of complicated cases, oxygen requirement, antiviral drug requirement, and healthcare professional requirement, because of which we have suffered a lot. I advise you many times not to watch the media, but I'm only quoting that through media we saw people running with oxygen cylinders in big cities like Delhi. The second objective is to prepare a possible roadmap to prevent and or mitigate the possible third wave scenario. these words are not absolute. They are relative. Mitigate or prevent. Okay. Even if you succeed 5-10%, it is meaningful. So this is it. So to arrive at these two objectives, I have created some headings for this. Before that, if I tell you something today and if I change tomorrow, don't consider that as an ambiguity. Whatever I am telling today is also true, because with the currently available scientific evidence, I will be able to tell that. If the evidence changes tomorrow or next week, I think I have to come back to you and say the current evidence says this. So in these extraordinary times, what really matters is our sensible independence. Sensible independence. You have seen the people moving around like nothing has happened, because no one sets our agenda or edits our behavior. I cannot tell you. You cannot tell me. We can keep delivering quality, trustworthy, fact-checked advice each and every day. I become very emotional while giving these lectures. The thing is, I become very angry in the hospital, because yesterday at this hour, I was in the hospital amidst 100 patients. Yesterday, we have given close to 400 vaccines in my hospital. Till today, Mysore University Hospital has given 21,000 vaccines to students, staff, and their dependents. And in the last 2 months, we have opened it up even for the public. Why I become emotional is, I have seen this disease as a doctor. I have seen this disease as a patient. I became infected. All my family members became infected 2020 August. And I have seen this pandemic as a parent of 2 doctor children. Okay, my both children are doctors and they are working. My son is doing his MD, and he has been posted in the beginning for 12 hours with PPE in COVID ICUs. Okay, we did not see their faces for nearly 3 months. So I can just quote, there are hundreds and hundreds of people like me who have passed through this. Okay, so please value our sentiments and have some take-home message at the end of the talk. So to arrive at those 2 objectives, what I just quoted, I've divided it into few headings to have a systematic flow. Understanding the present situation is important, but to do that, stop watching TV for their glorified presentation without a meaningful, implementable take-home message. I may shout 100 things, but my sincere request is, do I have some suggestion at the end of the talk? Just showing something, some funeral pyres, some dead bodies. Okay, what is that? We must arrive, not just a doctor or the government. Everybody has got a responsibility. If we do like this, it will be better. That should be the take-home message for everybody. We will see the seriousness of the disease. Waves, we use the word wave. There is no technical meaning for the word wave. It is just ups and downs what we see. I will try to show some of the countries, waves in different countries, disease and death burden in different countries, something in brief. Already this might be 10th lecture for some of you, something about the virus, something about the disease and general immunity, diagnosis and testing, preventive steps, vaccines and vaccination status, and finally, individual and public responsibility in prevention, under which I have dealt with some other headings. Now coming to the first 3 things, seriousness of the disease and waves in these countries. See, what I want to tell you now at this point is, at the time of this lecture, we already know that this coronavirus pandemic has killed lakhs of people worldwide, infected millions of people, and changed the lives of billions of people world in ways that were unimaginable few months ago, maybe about 20 months ago. So with this, I will just take you to some of the web pages, what I just downloaded. Can you see this? This is not just what I got. This is there in the public domain, isn't it? Yeah, let us see the world scenario later. I think I downloaded it on some other this thing. Look at this, US. They have seen more than 4.4 crores of coronavirus cases, 7 lakh plus deaths they have seen. What I want you to observe is this. Don't worry about these numbers. This is what I meant by wave. Wave. See, first wave, if you can follow my cursor, second wave, third wave, fourth wave, and now fifth wave. I want you people to appreciate one thing here. See, somewhere in mid-June, they have touched around 7,000 cases, 7 to 8,000 cases per day. But now, in the last almost 50 days, their average is 1.2 lakhs and above. Why I want you to have a good observation at this is, in what way they are bad compared to us, and in what way we are better compared to them, whether it is regarding vaccine or public behavior or healthcare facilities availability. India is no good compared to any other country. Look at you, India now, compared to what we have seen: 3.3 crore cases, 4,47,000 deaths, if statistics are correct. And this is what the wave means. We saw the peak of the first wave in September last and peak of the second wave in April, May of this year. And now it is still decreasing, but it is still fluctuating. So this is what the third wave means for India. Look at UK statistics. This is all worldometer statistics. Look at the fluctuations. Why? Opening up of the society is responsible for this. A small country with about 6 to 7 crore population, getting about 40,000 cases every day is a big number, very big number for them. So with this, let us get back to our presentation. This is what I meant by these waves and disease and death burden in different countries. It is too huge. I don't want to get into the actual numbers because they keep adding up every minute, both disease and death burden. Some of your friends and relatives must be working as doctors in US and European countries. Just call them up. For the first wave, we had the resources, we had the patience to listen to everybody. But for the second and third wave, we have exhausted everything. We do not have the attitude to listen to others during the second wave. How long can we sit at home? This is the thing that comes to everybody's mind. So now people who really helped so many people, so many patients during the first few waves, now they have become desperate. Some of my friends call me from US and say they are becoming angry because more than 95% of the people getting admitted to ICU for oxygen or even ventilator support are unvaccinated people, non-vaccinated people. That's it. So have this in your mind. So now about the virus, the disease, immunity, and something about testing and preventive steps. I will cover these three headings in the next few slides, and I will stop at that point and allow you to take up some questions with me. So this is the virus. This is an artist's imagination of the virus. This is not an electron microscopic picture, but I want you to appreciate the various parts of the virus because these parts act as candidates for vaccine production. If time permits, I will just arrive at that. Say, for example, we have two very effective vaccines in India, Covaxin and Covishield. Covaxin is this whole virus, this entire virus grown in monkey kidney epithelial cell lines. We inject monkey kidney epithelial cells inside a glass bottle. One virus becomes several million overnight. We just kill it with a small quantity of chemical called beta-propiolactone. The killed virus, when injected as a vaccine, will lose the ability to produce a disease, but will retain the ability to stimulate the immune system so that when a natural infection occurs, the pre-existing antibodies, because of the vaccine, will try to prevent establishment of disease by a wild virus. The second thing is, look at this spike protein S. Now we have our Covishield vaccine. To produce this spike protein inside the virus, definitely there will be a gene in the RNA sequence of that single-stranded RNA sequence of that particular virus. What they have done is isolated the gene coding for the synthesis of spike protein and incorporated that into a non-pathogenic virus, some other virus, adenovirus, that is a live attenuated virus. When that is injected into human body, that adenovirus establishes a non-pathogenic infection because it carries message or messenger from COVID virus spike protein. It will stimulate the immune system to produce antibodies against COVID virus spike protein. This is how we get protection. There are wonderful vaccines available in the West, like Moderna and Pfizer vaccines. Instead of incorporating the spike protein gene into another non-pathogenic virus, they have created copies of this messenger RNA. And that messenger RNA is used as a vaccine, and that itself is injected. RNA, it is nothing but a protein. It will keep on coding for the production of a complementary strand, which is almost like antibody to the spike protein. So in that way, Moderna and Pfizer vaccines will also induce a long-lasting immunity. Till last month, maybe August, everybody thought 2 doses will give a long-lasting immunity. But now in US, they have officially asked healthcare professionals, frontline workers, people who are more than 65 years of age, to go in for a 3rd dose or a booster dose of this vaccine. So go through this structure of the virus. Even if you are from arts background, I don't think it is very complicated for you educated people to understand the basis behind this. Next, there is virus in the patient. We are fortunate that virus is very, very sensitive. It cannot live outside the human body even for a few hours. It just travels either in the air or via the agency of an inanimate object like a pen or a mobile phone or whatever it is. And if a healthy individual touches that and carries it to the face, it will get transferred to him. Modes of transmission, theoretically, they called it droplet infection, coughing and sneezing and talking, throwing viruses into the atmosphere. And healthy individuals who are in close proximity with the patients catching up with the virus. Then fomite. Fomite is an inanimate object, what I just now described. But to my surprise, I am the subject expert for this disease. My specialization itself is microbiology and infectious diseases. Now, this disease, I am telling you, is airborne. There is no ambiguity in this. This disease is airborne. You just go and type, is COVID-19 airborne? ಗಾಳಿಯಲ್ಲಿ ಹರಡುವ ಕಾಯಿಲೆಯ. ನೀವು ಮಾಡಿ ನೋಡಿ. With the due apologies to my friends from Maharashtra, I just wanted to highlight this point. Just see this. You will get 100 references. Now, at this point, I want a societal response from you people. See, while advocating preventive measures, I don't think we have to be very cautious, because it is not going to make you spend money or anything from your side or from the government side. If a big organization, reputed organization like WHO, if that delays telling that there is man-to-man transfer, there is community transfer, there is a threat of airborne spread, there will be no compatibility between various countries. Why have we created WHO? Because it should act like the pivotal point where it will bring coordination among the countries. People, India was a virgin nation. International travelers brought it to our nation. And those people creeped, asymptomatic people creeped into the society, and they become responsible for spread of the disease. We know. If WHO had alerted in January last year itself, advocated strict control measures, I don't think the problem would have been this big by this time. This is airborne. Now I am telling you, sir is wearing, some of you people are wearing mask. I am not wearing mask, thinking that I am sitting at home in my room. There is nobody around. So I am happily sitting here. Some of you people sitting in your staff rooms and in the college departments are wearing masks. Good. I advocate that. I appreciate that. But my thing is my thing is now whether this mask is 100% foolproof. No. This, even as a doctor, I will not be able to use a 100% foolproof masks. We have respirators and all. While examining two people with PPE, I think I got COVID last year. Both the people died. One lady died in my hands, and the other, one of your senior colleague, died in the next 1 hour of coming to my hospital. Okay, that's it. So this disease is airborne. ಗಾಳಿಯಲ್ಲಿ ಹರಡುವ ಕಾಯಿಲೆ. ಆ ತರ ಎಚ್ಚರಿಸೋದ್ರಲ್ಲಿ ನಾವು ಯಾರನ್ನು ಹೆದರಿಸ್ತಾ ಇಲ್ಲ. We are not threatening the people in any way. Be careful. Because during these festivals, we have seen people gathering in the markets. I don't know how to convince them. I can't go stand there with a stick. We can't send some police to go and stand there with some regulatory measures and all that. We can give some meaningful advisories, that's all. It is left to the public to understand the science behind our advisory and implement. Now, about the disease. With whatever means the virus gets into the body, people will start developing symptoms from 2 to 14 days. From the point of entry of virus into the body till the appearance of the first symptom, this is called incubation period. Remember, it is varied from 2 to 14 days, and people in this incubation period are also capable of spreading the disease virus to others. I have created this slide just to make you understand, just because people do not have symptoms, that doesn't mean that they are safe and they will not be able to transmit the disease. Most of them end up with asymptomatic disease or with very mild symptoms, and they will recover. We are fortunate that that disease, in more than 90% of the cases, if you listen to the news at least 3-4 times in a day, they say India recovery rate is 97.8%. Today's radio, 97.7%. We are happy. People ending up with complications and death are less than 3%. But taking the load, I mean population load of our country, even 3% is a very big number. That's it. 100 crore population, 3 crore complications means it is a very big number. So from the onset of symptoms, during the next 7 days, some people will start developing an increase in the severity of symptoms, breathlessness, fatigue, and whatnot. If I have a slide, I will show you the vague symptoms. Now, fever, sore throat is not there. People are coming with joint pains, I believe. That's it. And some people recover from that stage. Some end up with respiratory distress, need oxygen, non-invasive oxygen, invasive ventilation. And I have seen hundreds of patients, known about thousands of patients from my friends. None of the people who received invasive ventilation have made it. All of them have succumbed to the disease. We don't do just like heart attack or stroke. We don't do any active resuscitation measure when the patient is dying, because we know that the lungs is already gone. So we have no other ways and means of making it recover. So we just leave him alone to peacefully die. We cannot do anything during that emergency. That's it. So this is the natural course that a COVID patient passes through. This is it. Next. Look at this. This is maybe an extension of the previous slide. Look at this. This tip of the iceberg concept, which is applied in all walks of life. Patient coming to the hospital and receiving care is just about 10-20%. More than 80-90%, they are asymptomatic, but not seeking care, but they're affected. They don't know that they are affected. That's it. Okay, but everybody continue to transmit infection to others. Even in those receiving care, I have made this small circle here. Mild or home care itself is enough in 80% of the patients. Some of them need oxygen. Some of them need ICU care. That's it. And during second wave, trust me, we are fortunate that we are alive today. Some of you will be getting some WhatsApp jokes, isn't it? Like in the past, people used to call up and ask, how are you? Now they're asking, are you there? This is a joke. Even one of my IAS friend told me this. People who have not called me for 10-20 years, now they call me just to know whether I am alive or not. This is a joke. But for people who have passed through this is not a joke. Whether it is loss of a family member, financial burden, emotional distress, not getting any support. Maybe we never distance ourselves like this from the society in the past. During anything, even during H1N1, I used to spend hours and hours with just a 3 rupee surgical mask inside the ICU, because not about vaccine, we were taking some antibiotic, antiviral antibiotic for prophylaxis at that point of time. Now, look at the symptoms. Nothing is specific. Fever, cough, fatigue, loss of appetite, shortness of breath, sputum production, body ache, loss of smell and taste. Some people proceed to influenza-like illness or severe acute respiratory infection-like. Now, coming to diagnosis, forget about the scientific part of diagnosis. We end up just putting a swab into the nose or into the... Why are you people hesitant to undergo the test, particularly when it is offered free to you? I have to share two of my experiences. Maybe about 2 months ago, one of our own professor, who is my friend in my campus, he felt offended because somebody told him that he has to undergo the test mandatorily before taking the vaccine. He came to me. Do you know what I did? I just held him in my hand, took him to the testing center in the other room. I underwent the test first because I am a doctor. Though I am vaccinated, I want to make sure that I am not infected, because vaccines are not inducing sterilizing immunity. It will prevent me from developing serious disease. But virus will be there. I will harbor the virus. I will continue to spread. Then he also gave his sample for testing. Just 2 days ago, Monday morning, maybe at this hour, I had been to Kudala Sangama temple. They didn't know that I'm a doctor, but they said, if you want to get into the temple, undergo RT-PCR test. I just gave the sample. My family members also gave the sample, sample. Then I told, are you just trying to meet the target set by the government? Then they said, yes, correct. But there is absolutely nothing wrong. When you become a policymaker, you will understand the difficulty of implementing those policies. Now, let us honor whatever people are trying to implement. We are all peripheral workers, you know. What the government says, we have to conform to the rule. You please yourself and you try to educate the people whom you come across, not to quarrel with healthcare professionals and frontline workers. Okay, there. ನಾನು ಸುಮ್ಮನೆ ಇನ್ ಕನ್ನಡದಲ್ಲಿ ಒಂದು ಮಾತು ಹೇಳ್ತಿರ್ತೀನಿ, ನಿಮಗೆ ಎಂದೋ ಒಂದಿನ ಕಾಯಿಲೆ, ನಮಗೆ ದಿನ ಕಾಯಿಲೆ ಅಂತ ಅಲ್ವಾ. You please understand the sentiment behind this one. So these two tests are gold standards in the diagnosis. Then if the patient develops a symptom, we do a chest x-ray, CT scan, and even doctors, all doctors did not have pulse oximeter in their clinics and at their homes. But now I think most of you have a pulse oximeter in your home, isn't it? So that is going to throw some light about the severity of the disease, and it will tell you when to reach a hospital or a doctor. Like then serology. Serology is looking for the presence of antibodies in an individual's blood, is like demonstrating the footprint of the viral infection. Bandu hogide. It has come and gone. This is what we want to do it. I just wrote it today morning, this serology, because in one of the slides subsequently, I will be showing you something about the serosurveillance. What serosurveillance means, I will try to explain that to you when that slide comes up. Then coming to the treatment part, don't worry about it. When you develop a symptom, go to the doctor, trust them. It is expensive, cumbersome. But if you reach the healthcare facility well in time, we can prevent the complication more than 98% of the times. These monoclonal antibodies, I just today added, because we are widely using these monoclonal antibodies. You might have heard of this tocilizumab, cocktail of monoclonal antibodies costing about 50,000 rupees to 1 lakh, used very early during the course of the disease and in mild moderate cases. Once the complication happens, it is not going to help at all. So if the doctor advises you to take this antibodies, please do not hesitate. What my principle is, take care of ourselves. Okay, we save for some nonsense, for some property, some car or something. If we are not there, what is the use of that? So please go to a trusted healthcare setup, end up following their advice strictly. Now, before I conclude this session, something about immunity. Some of you are casually walking in the streets after logging in. Then what type of trainers will you become? I said, basically, I am a teacher, you know. I am very strict in this. I respect you. I am getting calls from the hospital. My wife snatched the phone and put it on aeroplane mode. Because when I honor you, you also should be very serious. Even if I go to some philosophy lecture by a Swamiji, I go with a pen and paper. Because there are few things that we want to note down. Immunity. It is an individual's capacity to resist the disease. If you classify that, we have two types, innate and acquired immunity. Innate is something what we got by birth. Forget about it. Acquired immunity is what we are interested in. Follow this very carefully. I hardly take 2 minutes to explain this. Very interesting. I told you, even if you're a Kannada teacher, I will make it very simple. We take vaccine. So that means that we have done something artificially by injecting an artificial material. So this vaccine caused immunity, and that prevented me from developing natural infection by a wild virus. So this is what natural immunity and artificial immunity means. So they are active and passive. Both of them are active and passive. Natural active immunity is what I just described. Getting a disease and becoming immune. Passive is transplastic crossover of antibodies from the mother's blood to the fetal blood. Like, for example, measles vaccine, polio vaccine, DPT vaccine, we start giving it at birth. But measles vaccine, we give it in the 9th month. Why? The anti-measles antibodies that recipient's immune system is not playing an active role. We use the word passive artificial acquired immunity here. So this is about immunity. So now let me stop at this. Please open the session for questions. Rest of the things I will continue after your tea break. Please initiate some questions, because if you allow me, I will keep on talking some nonsense. That should not happen. I want to clarify some of the things what we have discussed till now.
Good morning, doctor.
Good morning, sir.
Sir, by God's grace, you are there. Country needs the people like you, sir.
Thank you,
so, your presentation and talk is superb, with an illustration and very, eloquent manner. And really, we are all enjoying it to learn the things. And I have a doubt, sir, regarding vaccination is concerned. And there is a myth among the people that there is a controversy also among the researchers and the doctor that whatever the vaccination will also killing the antibodies in the body of a human being, because since vaccination is a foreign antibody, that it goes into the body, that will kill the natural antibody and also causes other damages and all. Please focus a light on that.
One second. Thanks for the question and thanks for your compliments. That is an inspiration. That is the reward I want. If there is some benefit from my talk to some of you, that is the real reward I want. There is nothing big. You did not come to me with a garland or something. That's it. So I have not touched vaccine yet. In some of the first few slides itself, I think I will be covering 99% of the doubts. In my second topic, I will start with vaccines only. Okay. Please reserve this particular question for discussion at the end of the second talk.
Fine, sir.
Some of the things what I have covered till now, either about the virus, about the spread that's happening. I mentioned about the negative role that the WHO played. Okay, why Donald Trump stopped funding WHO because of this careless behavior. It is not just somebody telling. I introduced myself as the subject expert for this. Maybe I get certificates, particularly from my family, my wife. From January last, she has certified me 100 times. You have not changed even one word in your belief. This is what she says. From the beginning, you are telling the same thing. They are ridiculing those points in the beginning, and finally they are coming to your own point. Because even today, she is logged in with some other computer outside, maybe in the kitchen. Because if something goes wrong to this system, I can't allow you to waste time. I will jump to that system and start. So I always make her also log in and sit there for some time. That's it. So she has listened to this talk. Trust me, this may be 30th lecture in the last 20 months. And maybe 10th lecture in Academic Staff College podium itself. That's it. So from the points what I just mentioned till now, if there are some questions, I want to clarify here itself.
Sir, one more doubt I have, sir. The poor immunity system persons, particularly deceased or even normal people, now how can we improve our natural immunity, sir, in order to fight against the foreign virus like this COVID and others?
That's very important. See, when we come to prevention, because I did not bring that to this particular, to today's talk, prevention, there is primordial prevention, primary, secondary, and tertiary prevention. So there are 4 levels of prevention. Primordial prevention is genetics, the socio-political improvement of a country. Then comes health, that is primary level, where we use health promotion and specific protection as the 2 headings. Health promotion is what you are telling. Now, that is, we should not be stressed. We should not be overweight. We should be physically active. We must have a balanced diet. Okay. There are some unmodifiable factors like age and genetic predisposition for which we individuals do not have an answer. So the other modifiable things which are in our hand, we must be able to look at them. That's it. So how you can improve upon the thing? That is one thing, health promotion by way of all this. Specific protection is by way of vaccination. Anyway, because you are not coming with too many questions, I will take just one more slide here. When we talk about prevention, there are general measures and specific measures. With reference to COVID, it is vaccination. So general measures are this. Sense, not scare, is the key to stay safe. Sense. I will tell you a joke. What happened in our previous meetings in the same Academic Staff College? I was talking about physical distancing. The question came as, sir, how much time and how much distance? I asked them a question. How many times, how often do you buy milk? I asked. They said, sir, every day. Go to the milk booth once in 2 days. Bring enough milk and keep it in the fridge. It will reduce crowd at the milk booth by 50%. That's it. When you go to a vegetable vendor to save 10 paisa, why do you want to spend more time there arguing with him? He is also passing through a lot of stress. Give him 1 rupee extra. Run away from the crowd as early as possible. So this is not the practical solution that I have given you. I have given you food for thought. Apply the same principles in all walks of life. That's it. Students, they have not seen each other for months. When our campus, where I cater to about 8,000 population, Mahaja's College, UGC-HRDC College, Evening College, and my PG students here, when they came, the first thing they did was greeting each other. No mask. Even if the mask is there, it will be in the neck, hugging. What all we taught for 1 year just got diluted within minutes. We become unpopular advocating strict COVID behaviors. You carefully try to recollect this Swachh Bharat Abhiyan slogan. Kannadadalli ello kelide nanu. Naan galeej madalla, madavna galeej madak bidalla. Correct? मैं गंदगी ना हिंदी चनाग बरला गंदगी नहीं करूंगी या करने दूंगी अर्थ ಏನದು see we become unpopular at this but here I is not important what needs to be done is important while advocating these principles there are three ways one is propaganda somebody announcing in an auto rickshaw oh illi pulse polio program nadita ide ellaru hogi aksi pulse polio if you stop him and ask what is pulse polio he doesn't know somebody has given him a script he just keeps on shouting that is first method second method is policy if you don't wear seat belt you will be fined if you don't wear a helmet you will be fined so what happens if I see a policeman a police jeep I will wear the helmet or a seat belt. Once he is out of my sight, I will remove it. The third thing is by education. Whatever we learn by education is long lasting. I am not talking Purana. I'm not talking Purana. With this ever expanding population, it is practically impossible to achieve something by propaganda and policy. We can achieve something only by education. Try to recollect our own life. We want to build our house in a different architecture. We design different colors for the wall. Big screens. We want that TV, this colored car. When we design so much for our personal life, what prevents us from doing something outside? How much time do we spend inside the house? Our role is 75% outside the house. What we enjoy, what we cater to, what we take care, and where we earn our living is all outside the house. So let us be crisp and categoric while advocating these measures. That's it. So stay alert, stay safe, cover your face, nose, mouth, everything. These are etiquettes not designed for COVID. And most important, regular and frequent hand wash at least for 20-30 seconds. I have not put mask and sanitizer here. It has become an eye wash. It has become an eye wash. I don't want you to come and say what doctor he has not provided masks. He has not kept this pedal-operated sanitizer dispenser. Just to avoid such comments, maybe I have put this. But the most important take-home message is sense, not scare. What they created on this. See, if you ask me, sir, were you not scared when you became positive? I was scared. I was very much scared. Believe me, I was in the same room. I was in where I am lecturing now. I was in the same room. In the middle of the night, I got up and checked my oxygen saturation. I read the reading as 88. I really had palpitation, giddiness. Then I got up, sit, then just rubbed my eyes, reapplied. It was actually 98. In my fear, in my phobia, I read it as 88. Then I thought I should not be like this. I took remdesivir. I made my son come from Hubli, where he's doing his MD. All four of us took remdesivir. And my mother, my daughter, they recovered in 2-3 days. I took about 10 days. My wife took 15 days to recover. So there is nothing like age criteria and all here. So strictly, academically, what has been advocated, we followed up with all blood parameters. I was on anticoagulants for 3 months. My mother, my wife, they were all on anticoagulants for 3 months because now late complications I am seeing COVID ending up with gangrene of the toe. Where is COVID and where is gangrene of the toe? It is a post-COVID complication. I gave a certificate yesterday. Still it has not improved. He needs another 3 weeks of rest. Yesterday I was writing the certificate. That's it. Now, coming to vaccine, because sir asked, let me just cover this slide because we have another 10 minutes time before your coffee break. Vaccine, I already told you, it should stimulate the antibody production. And some people with zoology background can understand the second line also, cell-mediated immunity, activate T-cell mediated immune response to kill the virus. This is actually more important in viral infections. Second thing is, it should have a long-lasting immunological memory. If you take one Tetvac injection, how long you think you are protected?
6 months.
ಯಾರು ಹೇಳ್ಕೊಟ್ರು ಸರ್? ಶಂಕರ್ ಮೂರ್ತಿ ಸರ್?
ಡಾಕ್ಟರ್ ಹಂಗೆ ಹೇಳ್ತಾರೆ 6 months.
ಯಾರು ಡಾಕ್ಟರ್ ಹೇಳಿಲ್ಲ, ಸುಳ್ಳು. One second sir. ಯಾರು ಹೇಳಿಲ್ಲ, ಯಾರೋ ಮಾತಾಡ್ತಿದ್ರು, ನೀವು ಕೇಳಿಸ್ಕೊಂಡ್ಬಿಟ್ಟಿದ್ದೀರಿ ಅಷ್ಟೇ ಅಲ್ವಾ? No. It will protect you for 5 to 10 years. After the primary immunization, it protects you for 5 to 10 years. But the thing is, we forget that 5 to 10 years. So whenever you sustain a small injury, we advocate a booster dose for you people. That's it. There is nothing big. So immunological memory is long lasting. That's it. But in case of H1N1 and COVID, this may not be true because SARS and MERS, severe acute respiratory disease and Middle Eastern respiratory syndrome, they are brothers of the same coronavirus. So experience with these two infections says that immunological memory is not long-lived. I will come back to the previous slides later. Look at this, effectiveness of vaccines. Please give, this is very interesting. This is history, you know, very interesting. Who invented smallpox vaccine? Edward Jenner ಹೆಸರು ಕೇಳಿದಿರಾ? Edward Jenner.
Sir.
Some of you at least. Okay. See.
ಸಿಡುಬುರೋಗಕ್ಕೆ ಮದ್ದು.
Correct. ಅದೇ smallpox ಅಲ್ವಾ ಸರ್? ಸಿಡುಬುರೋಗದ ಚುಚ್ಚುಮದ್ದು.
ಹೌದು ಸರ್.
Okay.
Yes, sir.
See, the entire Europe will be passing through the scourge of smallpox. Edward Jenner's son asks the milkmaid coming to give milk to their house one very interesting question. The whole village or city is passing through the scourge of this disease. Nimage yak bandilla? You people escape from this disease, he asks. That girl, she was not literate, but she was educated. She says, while milking the cow's udder, we touch cowpox. Because of that, we don't develop smallpox. Look at that observation. Edward Jenner, who overheard the conversation between the son and the maid, he collected the cowpox material. Pox andreno. ಒಂದು ಗುಳ್ಳೆ ತರ ಬಂದಿರುತ್ತಲ್ಲ ಚರ್ಮದ ಮೇಲೆ. Pox is that. Okay. He just inserted neatly into the cowpox, drew the material and injected that into some people, some literature says, to his own son. And the rest is history now. That prevented the development of smallpox caused by variola. The virus he injected was vaccinia. ಈ ವ್ಯಾಕ್ಸಿನ್ ಅನ್ನೋ ಪದ ಹೆಂಗ್ ಬಂತು? ವೆಕ್ಕ, VACCA, ವೆಕ್ಕ ಅಂದ್ರೆ ಕೌ ಅಂತ, ಕೌ. Because first it was invented from the cow material, that name remained. The cowpox virus was vaccinia virus. The smallpox virus was variola virus. Because some antigenic similarity between the two viruses, the antibodies produced against the vaccinia virus prevented the deadly disease from variola virus. Nodi, ನಾನು ಸ್ವಲ್ಪ ಫಾಸ್ಟ್ ಆಗಿ ಹೇಳ್ಬಿಟ್ಟೆ, ಬಟ್ ಲೆಜಿಬಲ್ ಆಗಿ ಹೇಳಿದೀನಿ, ಕೇಳಿಸ್ಕೊಳ್ಳಿ ಅಂತ. ಇದರಲ್ಲಿ This is it. Allenaitu. Now, most of you born before 1980-82 have taken the smallpox vaccine. And we have taken the booster dose also here, illi, on the front of the forearm. Illi, on the deltoid region, we have taken the first dose and booster dose here. Nodkali, mark irutte doddavarigella. People who are born after 1982, we are not vaccinating them at all. Because we know that smallpox, variola virus has been eradicated from the globe. Why it became possible? There was only one stable virus without exhibiting any antigenic variation. Excellent coordination by the WHO. Good implementation by all the nations. And sensible cooperation by the people of every society in the world. Smallpox eradicated. We applied the same criteria to polio. Small pockets here and there. Adu cover agbudli anta. Vaccine escape enaru iddaddu anta. We started pulse polio program for the last 20 years, 25 years, and it is going on. At this pulse polio, how to advocate a social message regarding a health issue. I want to share my personal experience with you. Just now I told you that my son is doing his MD. 25 years ago, he was a 1-year-old kid. On one pulse polio program day, I was in my village. My father asked me, "Yenappa nin magangu pulse polio kodisbeka?" I said, yes, just because he is a doctor's son, he is not an exception, we have to give. My father called the maid girl and asked her, take this child through the village. Actually, my residence is in our farm. From there, we would have gone directly to the school where the pulse polio program was happening. But my father said, take this child through the village and reach the vaccination center. Then I asked him why. He said, everybody knows this girl. Ours is not a very big village. And if she is carrying the child, everybody knows that the child is your child. And without uttering a single sentence, we are advocating a doctor magune vaccination hogta ide. Now yaake hogbardu. This is it. This is an excellent lesson that I learned from my father. Without talking much, a social message has been served. That is it. This is how we must also advocate it. Pulse polio is almost eradicated because only the declaration by the WHO is pending. DPT, diphtheria, pertussis, and tetanus are all bacterial diseases. I don't want to get into the type of vaccine, toxoid, killed vaccine, and all that. I don't want to get into that. Measles vaccine, it is a live attenuated vaccine. Excellent protection. Then come to the last three. H1N1. Every season, the virus antigenically changes a bit. The vaccine manufactured last year will not prevent infection this year. So, for the beneficiary group, we need to give H1N1 shots, what do you call flu shots, every year. Okay, the new vaccine has already come to the market and I have given already for about 5-6 people in the last 2 weeks or so. It is slightly expensive. Each dose will be some 1,200 rupees. But in some of the special category people, we need to give it H1N1. So that is one small negative point about H1N1. Dengue. In the newspapers you are seeing, in Bangalore itself, after this rains in the last 2-3 months, dengue has come up. Why? The mosquito breeding places are more in this rain. The Aedes mosquito, responsible for the spread of this dengue virus from man to man, that is breeding in big number. Virus jasti agilla, solle jasti aitaste. That's it. So dengue, because it is known for mutations, keeps on changing its dress every day. What you call mutation? There is no successful vaccine till now. Whatever you read in the literature, read it only from the academic end. Aita? dengue vaccine idiyalla sir anta yaro kelidru. Then I laughed at it and then I called him separately and explained to him maybe about 2 years ago in the academic staff college premises itself. Then come to COVID-19. Let us look at only the positive things. Last year, at this last September, I was not pessimistic, but I was a bit apprehensive about the availability of a successful vaccine, or rather effective vaccine. But the earlier research done by everybody, genetic engineering to cell culture to everything, that made it possible in about 6 months from the emergence of this virus, an excellent vaccine has been manufactured, and already 5 different types of effective vaccines are circulating in the globe. Till today, we have not openly, Sputnik vaccine is also available in Mysore city now, the Russian thing. But who takes it? Because we are confident that the Covaxin and Covishield vaccine that have been in use maybe for the last 6-8 months are very, very effective. That's it. Because I am the subject expert, my doctor friends group asked me in the meeting, is there a necessity of a booster dose? Then I told them, undergo an antibody test. If our antibodies are below the range, take the 3rd dose because it is unofficial. Officially, we are not supposed to give the 3rd dose. If your antibody titer is good enough, why? It is superfluous, something extra which is a waste. So that's it. So at that time, including myself, we tested our antibodies. More than 1 is enough, but mine was more than 44. So where is the necessity of a thing? If you are in doubt, please go. This is not expensive. We spend about 800-900 rupees for the antibody assay. We can just get ourselves tested. So the carry-home message in this slide is why there was a successful vaccination for some diseases, why there is no vaccine at all for some diseases like HIV and dengue, and why it just keeps on changing. Maybe till today, COVID vaccine, we have not proved a big vaccine escape. Angandreno, vaccine escape. People have been given vaccine, but we are telling that it is not going to induce sterilizing immunity. It prevents development of a serious disease. So please take the vaccine. Sterilizing immunity and the infection agala. In polio, if oral polio vaccine is given by the drops, when the wild virus enters the mouth and reaches the intestine, it will not survive. The disease will not happen. Virus will not survive. He will not spread the virus to other people. But in COVID, there is possibility of getting infected, but not getting the big disease. That's it. So let me stop at this. We will go back to the previous 3 slides later. And during, anyway, tea break means what? Why can't you have your tea here itself and you do the talking for the next 15 minutes? Yes, sir. Anantnag, sir.
Yes, sir.
So why should we disconnect ourselves? I cannot give you tea.
Yes,
To the benefit of everybody, madam, you can ask some questions.
Sir,
Hey, sir.
sir, I want to know about immunity. There are 2 types, innate and acquired. Especially, I need to about the information about artificial immunity, sir. What are the things covered the artificial immunity?
Yes.
Or by the things can we get the artificial immunity?
By what?
Repeat
the question.
By the exercise or things, any things to get an artificial.
Sir, that's immunity analysis. That's general. You can improve your health status by which there will be an overall improvement in the disease protection. This artificial immunity and word apply agala. when we say artificially acquired immunity, there are only two things. One is either ready-made antibodies are given, like anti-tetanus serum, anti-rabies serum, anti-gas gangrene serum, ready-made antibodies. That's passive. Active artificial immunity is you give a vaccine, stimulate the immune system, produce antibodies, stimulate the cell-mediated cell, that is T4 lymphocytes. So when such an individual is exposed to a wild organism, whether it is a bacteria or a virus, these antibodies circulating in his blood will resist a successful infection. Artificial andre hange. Idu neevu heltirodu natural method adu. Maybe it falls into that natural thing. Yaudu eating well, keeping yourself fit and all that.
Okay. Thank you, sir.
Hello, sir.
Hmm.
Sir, what are the common side effects of the COVID-19 vaccine?
Nothing. Absolutely nothing. Don't worry at all. Don't worry at all.
Rural areas, so many people say that there is so many side effects.
Have you come across, or it is only by literature?
Oh.
No. Have you seen a complication?
No, sir.
Or it is after looking at the media and newspapers that you are asking?
Okay, sir.
No, let me tell you this. Why the take-home messages, absolutely no complications. When I started this vaccination program in February, trust me, I used to keep an ambulance ready to shift the patient to a higher center. Always, we two doctors used to be ready. Syringes loaded with adrenaline to prevent anaphylactic shock was ready. Steroids were ready. Oxygen was ready. We used to make the patient sit for half an hour after the vaccine. But now, in between what happened, forget it, try to recollect. But now we are going to the fields. That doesn't mean that we are playing with their life. We have the emergency medicines in hand, and there are absolutely no such side effects. And we have given 21,000 doses of vaccines till yesterday. That mild headache, we used to give 2-4 paracetamol tablets also in the past. But now, nothing. Just I reassure them. If something happens, come to me. I'm here till 8 o'clock. Don't worry. That reassurance boosts their morale like anything. Because 90% of the people coming to me, I know them by their name. Students, staff, their dependents and all, I know them. So they are very affectionate. They trust my approach, and we have been able to cover almost 90% of the people in our campus, thanks to the free supply. And some of the people who can afford, when I arrange the 3 vaccination programs at the cost of 800 to 950 rupees, too many people took it. They brought 4 or 5 family members and took it because I thought they were left. If people who can afford, if we pay something for the vaccine, people who can't afford in my villages, we can go to them fast. So, idu one advocacy. This is another help I need from you people. ಬೇರೆಯವರಿಗೆ ಒಂಚೂರು ಹೆಲ್ಪ್ ಮಾಡಿ ಕೊಡಿಸ್ಬಿಡುವ. ಆವಾಗ ಬೇಗ ವಿಲೇಜಸ್ ಗೆ ಹೋಗಿ ನಾವು ಅದನ್ನ ಕವರ್ ಮಾಡಬಹುದು. ಅದನ್ನ adverse effects, don't worry at all in this particular meeting. If this were to be a scientific meeting, I would have given you some slides, how to be prepared and all that. But for you people, my take-home messages, absolutely no side effects. That mild headache and all, vaccine ತಗೊಂಡ್ರೆ tension ಬಂದ್ಬಿಟ್ಟೆ headache ಬಂದಿರಬಹುದು ಅಲ್ವಾ? Believe me, for the first dose in February, I didn't drive. I took my driver to the vaccination center because I never wanted to experiment on my health. Or if something happens while driving, other people may be in trouble. So First dose, I really, very religiously, I sat for half an hour. I had a coffee with other doctors in Apollo Hospital, then came back. Second dose, we just went, and it was all experimental, for us. It was all experimental. Like you people, no certificate, nothing for us. We had to create the certificate for some other dates. Nothing was given to us at that time. It was all experiment.
Yes.
So, the coffee aita, can we continue?
No, sir.
No, sir.
Hello, sir, please. Sir.
Just 10 minutes. Wait.
Hello, sir.
Okay.
Sir, myself, my name is Shamgoda.
Sir, please,
No.
sir.
Sir, tea break ಆದ್ಮೇಲೆ ಮಾಡೋಣ sir. Please.
ಅಲ್ಲ ಇದು ಒಂದೇ ಒಂದು ಕ್ವಶನ್
No problem.
ಒಂದೇ ಒಂದು ಕ್ವಶನ್ ಸರ್.
ಹೇಳಿ ಸರ್.
ಸರ್, ಈಗ ಕೋವ್ಯಾಕ್ಸಿನ್, ಕೋವಿಡ್ ಶೀಲ್ಡ್ ಮತ್ತೆ ಅಮೆರಿಕನ್ ವ್ಯಾಕ್ಸಿನ್, ರಷ್ಯನ್ ವ್ಯಾಕ್ಸಿನ್ ಇವೆಲ್ಲ ಬರ್ತಾ ಇದೆ ಸರ್. ಇದ್ರಲ್ಲಿ ಯಾವ್ದು ಬೆಟರ್ ಸರ್?
ಎಲ್ಲ ಚೆನ್ನಾಗಿದೆ.
ಹೌದು ಸರ್. ಅಲ್ಲ ಈ ಒಂದು
ಈಗ ನಿಮ್ಗೆ
ವಾಟ್ಸ್ಆಪ್
ನಾನು ಇಲ್ಲಿ ತಡಿ ನಿಮ್ ಪ್ರಶ್ನೆ ಅಸಮಂಜಸ ಅಲ್ಲ. ನಿಮ್ಗೆ ಎರಡು ಉತ್ತರಗಳನ್ನ ಕೊಡ್ತೀನಿ ನಾನು. ಒಂದು, ಪುಣ್ಯ ಇಷ್ಟು ಬೇಗ ಇಷ್ಟು ಎಫೆಕ್ಟಿವ್ ವ್ಯಾಕ್ಸಿನ್ ಬಂದಿದೆ. ವಿತ್ ಡ್ಯೂ ಅಪಾಲಜೀಸ್ ಟು ಮೈ ಮಹಾರಾಷ್ಟ್ರ ಫ್ರೆಂಡ್ಸ್, ವಾಟ್ ಸರ್ asked us, which is the best vaccine among the 4 available things? American vaccine, that, this and all. Initially, when the messenger RNA vaccine, that Moderna and Pfizer vaccine was going on in US, I discussed with my friends and we arrived at a conclusion that Indian vaccines are the best.
Yes, sir.
But now this was a scientific discussion, not out of emotions that we are Indians, we had that ego or something. Angenalla. Scientific discussion. Because messenger RNA vaccine was introduced for the first time in the world. We didn't know.